My involvement in proctology was not by design. I'm an American board certified surgeon by training, both in general surgery and vascular surgery. And when I first started my practice, I hated two things that we used to do. One is the hemorrhoid surgery, and the second was the varicose vein surgery. Because the method we used those days were similar to what we'd done for hundreds of years. I was looking for new methods. I was trying to think out of the box, and I couldn't find anything until about 2003 when the endolaser technique came for treatment of varicose veins. And I loved it. And I was one of the earliest adapters in the US for the closure of the saphenous vein in treating varicosities. But later on, in 2006, I started to use it for treatment of hemorrhoids, which are similar vascular structure like the varicose veins, but in the anal canal. The idea of being able to permanently close a tubular tissue structure by endolaser, by lasering it from within, was fascinating to me. At first, we succeeded in treating most hemorrhoids by this method. Then we started to think about using it for fistula, which is another tubular structure in the proctology field, and similarly the pilonidal cyst, and so forth and so on. And we ended up with a collection of procedures that are minimally invasive, extremely effective, painless, and can be done on an outpatient basis. Most general surgeon, unfortunately, thinks that in order to develop proctology laser practice, you need to buy one or two equipment or go attend a few days course. It doesn't work that way. The only way to learn how to do advanced proctology is to join a group dedicated to this practice. And it's very hard to actually succeed without getting involved in a systematic training that teaches the new principles discovered in proctology. There is a reason why we do more than 1,000 laser procedures per quarter, every quarter and every year, year over year. We've been in practice now for almost 10 years, since 2015. And we became the largest advanced proctology group in the Middle East, and among probably the largest in the world. And this is for a reason, because our procedures are not offered by any other hospital or a group. We innovated. We came up with procedures like AG1 and AG2, AG3 and AG4. We have 9 new procedures developed for multiple conditions in proctology, like hemorrhoids, especially advanced, and fistula, and fissures, and pilonidal cyst.